Joe Loftus and I'm the physiotherapist with the Occupational Health Department. This film is aimed at anyone who has or has had any leg symptoms. The idea is to talk about causes of leg symptoms, treatment options and to show some example exercises. Osteoarthritis of the hip describes what happens when the cartilage lining of the ball and socket hip joint, which you can see here, changes with age, resulting in pain and stiffness. People often complain of pain in the groin area when sitting, when rising from a seated position, or when the legs are crossed, aggravated by weight bearing or prolonged positions. Sometimes the hip can feel stiff early in the morning, and weaker muscles can result in pain on the outside of the hip as well. Physiotherapy can help by providing a tailored treatment plan to increase movement in the hip and to strengthen muscles around the hip to help you, alongside offering advice on future management. Keep your feet together and just bring your knee up just to about there. It's fine, that's perfect. You should feel that you're using these muscles here, but you haven't reached the point where your pelvis is rolling back, alright, which is exactly what we want. And just try and hold there for 10 seconds, okay? You should feel fairly comfortable, but you should feel you're using those muscles. And then back down. And trying to repeat that up to 10 times and have a little rest, then another 10, then another 10. Okay?
Yeah.
As I say, that's really good for the muscles that help to support your hip.
Okay.
This describes pain arising from the joint between the back of the kneecap, shown here in green, and the femur, which is felt at the front of the knee and gets worse with things like kneeling, squatting, or climbing stairs. This can be due to a number of factors, and a physiotherapy assessment can help identify these and show you specifically what to do. In general, the quadriceps muscles at the front of the thigh are important in controlling and supporting this joint, so it's important to make sure that those alongside the hip muscles are strong and that the muscles around the knee aren't tight. So exercises like these can help. Just to tighten these muscles here by trying to push your knee down into the bed. Yeah, that's it, lovely. I can feel those muscles switching on. If you pull your foot up towards you, keeping that knee nice and straight, that helps those muscles fire, and then just lift and hold there. Okay? Aiming to hold for about 10 seconds, repeated 10 times. Symptoms at the front of the knee is just to make sure that you're nice and flexible in the quads. Okay, so a good stretch for that is just, do you want to take a little bit of balance from me? Okay, that's good. Your thighs are parallel, you aren't bent over in the middle. Can you feel that stretch at the front of the leg? Yeah. Holding that for around about 30 seconds and just repeating that several times through the course of the day. Okay. Moving down to the ankle, probably the most common problem I see is a sprain of the ligaments on the outside of the ankle, which generally happens when someone goes over on their ankle. This can be really painful and it can swell or bruise. In the early stages, rest, ice, compression and elevation are helpful, followed by gradually getting the ankle moving as comfort allows. These ligaments help to prevent your ankle from moving excessively, so if they're injured, it's really important to work on balance and strength of the muscles around the ankle to take over this role. For example, by balancing on one leg. Depending on the severity of the injury, improvement can take a while, so it's important to stay motivated to get the best out of your ankle. Making sure that your balance on that side is as good as it can be is really important. Okay, so just as simple as just balancing on one leg. Alright, and and just holding that balance there. Okay, that looks really good. You can make that more difficult for yourself by closing your eyes, which does look a bit more tricky. Okay, or you can make it more difficult for yourself by having someone at home to pass a ball to you or throw a ball against the wall, so you've got a bit of movement with that.
Okay.
Okay?
Yeah.
Thanks for watching. I hope that's been beneficial for you. If you've got any questions or you want to refer yourself for physiotherapy with me, you can contact me at joseph.loftus@nhs.net, or you can contact the Occupational Health Department on 01977 60 5585.